Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating case study on the use of leflunomide as a treatment for immune-mediated uveitis in a dog. Our story begins with a 5-year-old castrated male Bichon Frise. This particular dog presented with a history of chronic bilateral uveitis. For 6 months, the condition had been managed with systemic steroids, which led to some unwelcome side effects such as weight gain, excessive thirst, and frequent urination. The goal was to find a treatment that could control the uveitis without causing these systemic side effects. The veterinarians initially switched the dog to oral cyclosporin after discontinuing the oral steroid. The cyclosporin, however, had to be stopped just a month later due to severe vomiting. It was at this point that leflunomide was introduced into the treatment plan at a dose of 2 milligrams per kilogram every 12 hours. Remarkably, within 2 months of starting leflunomide, the symptoms of uveitis resolved. The dosage was carefully adjusted as the clinical signs improved, and the dog remained relapse-free for the next 13 months. Unfortunately, the leflunomide therapy had to be discontinued when the dog experienced vomiting due to severe gastroenteritis and pancreatitis. Topical prednisolone monotherapy was then continued. 8 months after stopping leflunomide, the bilateral uveitis returned, and leflunomide therapy was started again. Despite resuming treatment, the dog's vision deteriorated, and 33 months after the start of leflunomide, the dog lost vision. Eventually, 43 months after commencing leflunomide, the glaucomatous right eye was eviscerated. A histopathologic examination, a microscopic study of the affected tissues, revealed lymphocyte and plasma cell infiltration, along with melanin-laden macrophages in the uveal tissue. Based on these findings, the dog was diagnosed with immune-mediated uveitis. So, what exactly is uveitis? Canine uveitis can be classified based on its cause, including infectious, neoplastic, metabolic, immune-mediated, traumatic, or reflex causes. Immune-mediated uveitis is often diagnosed when other potential causes have been ruled out. In fact, many cases of idiopathic uveitis, where the cause is unknown, are believed to be immune-mediated. Prompt treatment of anterior uveitis is crucial, typically starting with topical anti-inflammatory therapy. If not controlled early, anterior uveitis can lead to complications such as synechiae, secondary glaucoma, cataracts, endophthalmitis, and phthisis bulbi. While topical treatment might be sufficient for mild cases, it's often inadequate for severe uveitis, posterior uveitis, or uveitis that stems from systemic disease. Systemic corticosteroids are commonly used as a first-line treatment for severe uveal inflammation in both cats and dogs. Other systemic medications may be considered for canine patients when the condition is deemed immune-mediated or unresponsive to initial treatments. However, these immunosuppressive agents can bring about unwanted complications like gastrointestinal issues and myelosuppression. This is where leflunomide comes into play. Leflunomide has been shown to be well tolerated by dogs at appropriate doses and has emerged as a potential treatment for immune-mediated inflammatory diseases. In this particular case, the Bichon Frise had a history of severe pancreatitis and allergic reactions. Occasional vomiting was also noted, particularly after stressful events. Prior to this case, the dog had been diagnosed with bilateral cataracts and uveitis with posterior synechiae at another clinic. Initial treatment involved systemic prednisolone and various topical agents, including cyclosporin, prednisolone acetate, florbiprofen sodium, ofloxacin, and atropine sulfate. While the uveitis initially improved, the dog experienced significant side effects from the long-term prednisolone use, including a 30% increase in body weight, restlessness due to increased urination and thirst, and continuous panting. Upon examination, the dog's body condition score was 7 out of 9. Neuro-ophthalmic examination revealed menace response and dorsal reflex in both eyes, but the pupillary light reflex was incomplete due to posterior synechiae. Further examination showed conjunctival hyperemia, episcleral vessel congestion, incipient anterior subcapsular cataract, and extensive posterior synechiae. Corneal lipidosis was also suspected. The intraocular pressure was 11 and 6 millimeters of mercury in the right and left eyes, respectively. Considering the dog's history and examination findings, a diagnosis of idiopathic anterior uveitis, likely immune-mediated, was made. To mitigate the systemic side effects, the oral prednisolone was gradually reduced and oral cyclosporin was introduced. Additional topical medications were also administered. While the aqueous flare, an indicator of inflammation, improved initially, the dog soon experienced severe vomiting. Despite adjusting the formulation and adding esomeprazole magnesium, the vomiting persisted until the cyclosporin was discontinued. Unfortunately, the uveitis relapsed a week later. Leflunomide was then prescribed at 2 milligrams per kilogram every 12 hours, along with existing topical medications. Over the next 2 months, the clinical signs of uveitis gradually improved. The posterior synechia did not worsen, and episcleral vessel congestion was minimal. The intraocular pressure stabilized, and menace response and Dasl reflex were present. As the uveitis symptoms subsided, the leflunomide dose was tapered over 13 months, eventually settling at a maintenance dose of 0.5 milligrams per kilogram every 12 hours. 15 months after starting leflunomide, the dog experienced anorexia, bloody vomiting, and diarrhea. Despite stopping leflunomide, the gastrointestinal issues persisted, requiring hospitalization. Although systemic immune suppression with leflunomide was not resumed at the owner's request, the owner was informed that the uveitis could return if the medication was not resumed. 8 months later, the dog returned with relapsed uveitis. Leflunomide was restarted, along with famotidine and topical prednisolone acetate. Over the next 8 months, the uveitis signs recurred despite the leflunomide administration and intermittent use of low-dose oral prednisolone. Frustrated with the long-term medication, the owner began adjusting the leflunomide dosage based on the dog's hyperemia. Sadly, the dog eventually lost vision bilaterally. The dog revisited the clinic 8 months after the vision loss with a glaucomatous right eye. Ocular sonography revealed several issues, including decreased lens size, irregular posterior lens capsule continuity, and increased echogenicity in the vitreous chamber with retinal detachment. Evisceration, the removal of the eye's contents, was performed. Histologic examination revealed hemorrhage, fibrin, collagen, retinal and uveal tissue, and remnants of the lens capsule. The uveal tissues showed infiltration by lymphocytes and plasma cells, as well as melanin-laden macrophages. The retinal tissues were atrophied. A final diagnosis of moderate lymphoplasmacytic and granulomatous uveitis with melanin-laden macrophages, suggestive of immune-mediated uveitis, was made. Following evisceration, the inflammatory signs subsided. The left eye, treated only with topical prednisolone acetate, progressed to phthisis bulbi due to chronic inflammation. This case highlights several important points regarding the diagnosis and treatment of immune-mediated uveitis in dogs. Most idiopathic uveitis cases are immune-mediated and diagnosed by excluding other potential causes. While histopathologic evaluation is the most accurate diagnostic method, it is not commonly used for intraocular tissues. Therefore, the therapeutic response to treatment can be used to diagnose immune-mediated disease, especially when extensive diagnostic testing is not feasible. In this case, other potential causes such as primary neoplasia or metabolic diseases were ruled out. Although serologic tests were not performed to determine the cause of infection, the uveitis symptoms improved with immunosuppressive treatment without systemic side effects related to infection. The dog's history and clinical signs led to a tentative diagnosis of immune-mediated uveitis, making immunosuppressive treatment a reasonable approach. Leflunomide has demonstrated efficacy in treating various immune-mediated diseases in dogs, including immune-mediated polyarthritis, refractory inflammatory colorectal polyps, and immune-mediated thrombocytopenia. Studies have also shown its potential to inhibit autoimmune uveitis in rat models. In humans, leflunomide, often in combination with other medications, has been used to manage severe uveitis. In this particular case, the dog experienced side effects from long-term use of systemic prednisolone and cyclosporin. While mycophenolate mofetil is another option for treating immune-mediated uveitis, it was not used in this case due to the high risk of gastrointestinal adverse effects. Other medications like cyclophosphamide and chlorambucil were also considered, but not used because they are conventionally used for chemotherapy and often lead to gastrointestinal side effects. While leflunomide can cause side effects such as decreased appetite, lethargy, lymphopenia, thrombocytopenia, hepatotoxicity, and vomiting, it is generally well tolerated by dogs at appropriate doses. In this case, the gastroenteritis and pancreatitis were not definitively linked to leflunomide, as the dog had a history of occasional vomiting prior to its administration. During the initial continuous treatment period, leflunomide was relatively well tolerated, vision was maintained, and the uveitis was controlled. While monitoring serum concentrations of teriflunomide, a metabolite of leflunomide, can be useful in humans, it was not feasible in this case due to the lack of available testing for dogs. Additionally, the pharmacokinetics of leflunomide can differ between dogs and humans. The histopathologic findings raise the possibility of canine uveitis syndrome. However, the dog lacked the characteristic clinical signs such as dermatitis or skin problems. Considering the histopathologic findings and clinical signs, a final diagnosis of idiopathic immune-mediated uveitis was made. In conclusion, this case suggests that oral leflunomide therapy alone can be effective in controlling relatively early-stage immune-mediated uveitis without significant side effects in dogs who have experienced adverse reactions to other immunosuppressants. Therefore, leflunomide appears to be a viable treatment option for canine idiopathic immune-mediated uveitis. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.